So, welcome back to the latest episode of Taking Charge of My Cancer podcast with Zora Benhamou. She is a gerontologist who studies aging and is dedicated to challenge menopause stigma and ageist stereotypes. As the host of the Hack My Age podcast, she focuses on empowering women navigating the menopausal transition through biohacking techniques. Zora serves as a passionate menopause educator. She's the visionary behind hackmyage.com and the author of the Longevity Master Plan and cookbook Eating for Longevity, offering invaluable resources and programs for women in peri and postmenopause. Sora's commitment to normalizing menopause conversation is evident through her creation of the support group and community. So thank you so much, Zora, for being here with me today.
Thank you. Thank you for having me. What a wonderful introduction.
Thank you. So, what inspired you as a gerontologist to start a podcast focused on menopause?
Oh my goodness. Well, it started out probably around COVID. Like everybody else, we all started podcasts at COVID. And my focus really was on women's health, women over 50. And I was studying for my gerontology master's at the time. And so I was learning a lot about the body and the changes. But actually, all my guests were about health and wellness for women over 50. But it's my audience who asked me, can you please invite more specialists on menopause, more specialists on menopause and on hormones? We want to learn more and more about this. And it was actually my audience that threw me in this direction. I myself was going through perimenopause at the time. So I thought, well, why not? I better learn about this myself. Anyways, so that's how I got into the menopause. And the more I dug into it, the more I was fascinated. And then I started to look back and I thought, oh my goodness, yeah, I really was going through perimenopause, didn't even know what the word perimenopause was. And I realized we need much more information out there. So that's why we just sort of shifted the podcast into the menopause space. I still am considering the 80-year-old self, right? The how are we going to protect ourselves of the future? So that's the gerontologist in me. I won't let that go. Of course, we want to feel better now. We want to take care of our symptoms. We want to subside them, but we need to also consider our future selves. And then that means we have to take our health to a little bit of a next level if that interests you.
Absolutely. Do you want to explain to the audience a little bit what is a gerontologist means?
Yes, that's a good question. Thank you for asking. A lot of people think it's a geriatric
Yeah,
physician. So I'm a
yeah.
doctor, and the geriatric physician is a doctor who takes care of older adults. A gerontologist is somebody who just studies aging and longevity. We want to look at not only the biological aspects of aging, but the psychological and the sociological aspects of aging, why we get diseases, how are we aging, and we look at the whole life course from birth until death to understand this whole process. It's not if we do advocate for older adults, we do have a focus on older adults, but we to understand the health of an older adult, we do have to go look back in time and see what happened during that life course. So it's more of the study of aging.
Excellent. And as a gerontologist, how did your background shape the way that you see menopause? Not just as a hormone change, but as well as a broader aging process.
I'm not sure I understand the question. How?
So, like, if you look at menopause and the changes through life with the
Yes.
eyes of just being who you are versus how that gerontologist background is
Mm.
helping you to see menopause from different lens.
Oh, yes. That's a good question. It is a very good question. And I think this is something that I probably wouldn't have thought of if I didn't become a gerontologist. But
Uh-huh.
it is really important that women understand the changes that are happening in the body. And again, like I mentioned, I look at our future selves because what we do today in our 50s will influence if we get certain diseases in our 70s and 80s. And Alzheimer's, for example, doesn't start when you're 72. It starts decades before, and maybe we don't feel it. And maybe same thing for osteoporosis. It doesn't just bones get fragile and you break it and fracture it in a day. It's a long, long process. And we start to lose bone density in our 30s. So we have this sort of peak mass that happens when we're younger, and then it just declines. But we're not paying attention to this. And the biohacker in me, and the biohacker again is just somebody who likes to look at the we like to test, measure, and assess things. It's not just sort of let's take a vitamin C
Mhm.
and get on with it. No, we want to see, we want to measure our levels, we
Yeah.
want to see if something's working. A biohacker is usually somebody who wants to be in an optimal range when we have a blood test taken. We don't like normal ranges because we understand that normal means sick because it's the average of the population. So we do all these little self experimentation, and we do this little we called an N of one experiment, and that means the most important person in the room is you. It doesn't matter what the study says. We love to look at research and we love to look at what is the latest studies and the trends are, but it doesn't mean anything if you're not responding to it. So this is the biohacker in me also likes to connect with the gerontologist in me and say, look, okay, if we're going to protect our bones for the future, then let's test them now, even if we're 40 or 50. We need to understand where's our baseline, where's our point, and then continually measure depending on what your your results are, but more or less every year, every couple of years, and say, is there a trend? Is this going down? And if it is, then let's do something about it. So the gerontologist in me understands that menopause and the loss of our hormones creates a massive shift inside. And if you're anyone who's had surgical menopause, medical menopause, where you're thrown into menopause in a day. Not you didn't have this gradual or these even these
Mhm.
fluctuations. You
Mhm.
feel it from day one. You understand what that means to not live with your hormones. You're achy, you're tired, you're moody, you're anxious. All these menopause symptoms, hot flashes, like some suddenly come out of nowhere, and you're thinking, well, I'm only 35, like what's going on? And you feel it. Now, what when you're going through a natural menopause and it's more gradual, yes, we do feel it. And of course, some women feel it more than others. And then there's 25% of the population who feel nothing. But that doesn't mean nothing's happening under the hood. Like if you were to test your bones, your heart, your cardiovascular markers, your brain, everything is changing and shifting, even if you don't feel it. And this is why we call certain diseases silent killers, like cardiovascular disease, because it's silent. You don't really feel it until you actually have a heart attack. So we need to understand that menopause is a major shift. It's we can it can be scary with some of the social media information that you see out there. Not everyone's going to fall off the cliff, and we can get through this transition just fine. But I do want women to pay attention that even if you are just fine, I'm always worried about the asymptomatic women because she's not going to really check her what's happening under the hood. So I want
Totally.
them to really look at their health now. It's a wonderful opportunity to take care of yourself now for your future self as well.
And I'm so glad that you mentioned that because this is exactly what I see. So the plan where I am, because I'm a physical therapist and working in an oncology world, again, a lot of my audience and a lot of my patients are being passed, they're going to be thrown into this medical menopause or early menopause because medications. But at the same time, I'm surrounded by other friends and family who I'm learning so much about menopause and how you gotta be taking care of yourself now. And even if you feel okay, that doesn't mean that you're okay. So it's kind of glad that you mentioned how the silent disease that can be happening to you that you don't realize until it happens. So try to really sell that information into like just let's be proactive versus reactive in regarding let's take care of that. So it's really sometimes try to change that mentality when somebody's like, well, I'm okay with that. I don't need hormones or I don't need to do all that test because I don't feel any symptoms. I'm totally okay. And it's like, oh yeah, but you don't know that, right? Until you go and get yourself tested and check into all these other things that perhaps you have not been thinking about it. So glad that you mentioned that.
And it's good to get a baseline when you're feeling okay, everything's
Exactly.
fine. And
Yeah.
it's not to scare people. And if you got to take some of these tests also with a grain of salt and where you're at, and you don't want to get obsessive with it and it's going to dictate your day and ruin it. No, we just want information and data as we go along through life and as we age to know what's normal for us. Because if you're feeling great, like that's wonderful. Normal for you may be very high cholesterol, I don't know, or very high hormones or very low hormones. I don't know. Like, we need to know where you're at when everything's quite normal and then look at the trends as we're aging.
Some of the common myths or misconception about menopause that you often try to debunk on your show.
Oh my gosh, there's so many. I get a lot of, oh, I didn't do menopause, or and I skipped menopause. And when I interview women on the street, I interview a lot of them for these little reels that I make on Instagram and Facebook, and they're 62, and I said, well, you still have a period, and they say no. No, I don't. And I said, well, then you are in menopause and there are things that are happening, but they're referring to those symptoms or the transition being very difficult. But you also get the woman who's in her 40s and go, I'm not in menopause, or they don't know what the word perimenopause is, and I'm too young for menopause. Or even doctors gaslighting their patients who are feeling menopausal symptoms at 45 and saying you're too young for menopause. And just no, you're not. You're going through perimenopause and there's solutions. So those are the age thing and the way we associate it. And I want to sort of disrupt this ageist stereotype that's associated with menopause. When I ask women on the street, can you ask you questions about menopause? Sometimes they look at me like, no. And did you just insult me and say I look old? I said, no, that's your own ageist stereotype. I'm in menopause and I'm 55 and I'm like, that's just what it looks like. So I think this is one of the stigmas or one of the problems, the myths that we have to bust is that no, you're probably not too young for menopause.
Okay, that's a very good. That's so true. I like it. And I was listening to one of your latest podcast episode about ages, right? Like people associate certain age, where were you, is certain things that you need to do. And then this, I get this all the time from patients like, what are you talking about? Are you making me work into a high interval training program? I'm 80 years old. What are you doing? And I'm like, age has absolutely nothing to do what you're capable of doing or how you look or the expectations you have. Just because you're older doesn't mean that you cannot do a lot of things that perhaps your body is capable of doing. So why no preserving that if you can do it? So kind of,
Hmm.
I'm really glad that really people is so afraid of saying their age or facing what that age means, but that age doesn't mean anything, right? It's just mean a number. It has
Exactly.
nothing to do how you feel or what you're capable of doing.
Exactly. And we're trying to show people that there's a menu of choice to aging.
Mhm.
I mean, there's some people really have a bad luck. You got hit by a car or a disease
Yeah,
or, things happen, but the majority of us can choose how we age. And that's being proactive. And proactive is not fun. It's not sexy. Like it's hard work. I mean, it doesn't have to be hard work, but we
yeah,
have this image that it is. And so, yeah, and it is our own ageist stereotypes. There's so much research done on people all over the world in different countries, different cultures, and we're all ageist. That's to one degree or another. It's just a fact of life. We idolize youth. It's the fountain of youth has been around since millennia, and so again, it's nothing new.
yeah.
But some cultures are more ageist than others. Some people are more ageist than others, and some of the most dangerous ageist. The problem with being ageist is that you can be ageist against your own self and have a self-perpetuating behaviors. So if you believe that, oh, when I get old, I will be in pain and I will walk slow and everything will slow down and everything will hurt, then you accept that. You don't actually go do something about it because you're internalizing your own ageist stereotype. And that's very dangerous. That's something we need to disrupt because you have a choice. You don't have to slow down and you don't have to be in pain. So this is a point where you go to the doctor or you get a physiotherapist or you get a surgery or whatever it is to fix the problem. So we need to be inspired by those people who are living their lives, living full lives, doing the things that we would like to be doing. It does, whether it's climbing Kilimanjaro or it's just traveling pain free. It's up to you. So that's what we're trying to do is disrupt some of these stereotypes.
How does menopause differ for women who go through it natural versus those who enter menopause due to cancer treatments?
Mm, yeah. Well, very different. It's very, very different. And as we mentioned before, you are thrown into early menopause. This is not a natural state of being. So you are immediately having your hormones removed, and we have enough research and data, and we know what happens as a woman ages naturally without her hormones. She's just at more risk for cardiovascular disease and Alzheimer's and dementia and osteoporosis and all these diseases of aging. The risk goes up. But when the risk goes up when you're younger and when you're in this traumatic state and it is a real stress on the body, those risks are even higher. And that's why it should be standard of care. But I meet many women who don't get offered hormones when they're in their 20s or 30s or 40s because I don't know, the doctor hasn't given them. And I've had interviews with doctors who say that should be malpractice. It is the standard of care. It should be. And plenty of women are not being offered hormones. And the reason why it's standard of care for a younger woman is because the risks of osteoporosis and dementia and cardiovascular disease are much higher without the hormones. What ticks me off is like, with that standard of care for a younger woman, why are we not offered this when we're in menopause? And very often it's because you're not reproducing anymore, or it's as natural, or this is normal. You're going to die anyways. That's like the natural process. That's okay. That's what we're all going through. But as a biohacker, I'm like, well, no, well, can I delay it? Can I just like move it a little forward so I have just a short period of disease and then die? I don't want to have this long, drawn out process and continue to go to doctors and take medication. And this is what's happening in the world as it is. So yes, we can do things, but when you're going through a medical menopause or if you're thrown into radiation and chemotherapy, the risks are higher. Your bone density is going to you're going to lose much more bone density a lot faster. So this is where we really need to take care of the body and the terrain. I don't think it's only hormones. Hormones are a big
Yeah.
piece of the puzzle,
Yeah.
but you also need to be detoxing those hormones. You also need to be in a good, healthy state to absorb and take these in. So, and that's just one part, but for the rest of the body is quite miraculous in how it can heal and take care of itself, but we have to set it up. And again, it's boring and people don't like to do it and it's a lot of work. Again, it doesn't have to be, it can be fun, but you really need to change that mindset and clean up the terrain and start to live a healthier lifestyle and the diet as well, if you are concerned about those diseases of aging. And again, this is you and your body. It's your life. You can do whatever you want. But if you are concerned, then now is the best opportunity after your treatment or during your treatment, wherever it is you are in this space, to start taking care of your health right now. And then have that conversation too about hormones for sure, is particularly if you're young. But I think every woman should at least have that conversation with their doctor about hormone replacement. And there is hormone replacement for women who are in post breast cancer.
Yes. And that's again another very, very kind of like a scary, hot topic. I don't know how to call it, but again, we go into typical, in Western medicine, is like you have a hormone positive tumor. No, you have to have hormone blockers or endocrine therapy for 5 years or 10 years, and then we're talking about that to a woman who is on their 30s or 40s, right? It's like, whoa, whoa. So what's going to happen after that, right?
Mm-hmm.
And then is again more and more research, which is a good thing coming out about like is that for sure that hormone blockers is a good thing versus it's not? Or what is the benefits of it? Like, do we look more into this cancer recurrence versus really heart disease, Alzheimer's, osteoporosis, all these other type of issues that can be happen because
Mhm.
estrogen going down. So again, hard decisions to make when you're in that cancer space, right? Because I'm sure for what I see every day with my patients, it's like, it's scary. It's like, what do I do? The doctors
Yeah.
are telling me to do this, but I see what you're saying, and I see how I feel. But if I stop doing this, or I start just having hormone replacement, even through breast cancer, hormone positive, what if I get cancer again? So I'm doing this to myself. So it's really a hard situation for them to see I'm doing the right thing or not, right? So hopefully more and more evidence is coming out, and the needle is moving to looking more into, is that the right thing to do?
Well, this is where a woman needs to advocate for herself and do her own homework. And I think women who have a disease, any kind of disease, you suddenly get a PhD in that disease because you are learning and reading and diving and like
Yeah.
trying to make decisions for yourself. Because even though you have a doctor, you still want to become prepared to that meeting. And there's some women who are more dive deeper, and others who just can't handle it and don't want to, and will just do whatever the doctor says. And again, it's up to you. But if you are one of these people who are taking deep dives into your health or your situation, your diagnosis, when it comes to breast cancer, there is a lot of evidence that vaginal estrogen is safe
Yes,
for women, even with positive estrogen, positive breast cancer. So that's kind of, I think most people are in agreement. And that's why the FDA is trying to remove that black box warning, because the data shows that it's safe. So that's just for the vaginal, both. And what about all the other ones? And then that gets more controversial in terms of estrogen. We're talking about estradiol, bioidentical, synthetic, like it's all over the place. So you have to learn all about that. But I just interviewed Dr. Lindsay Berkson, and somebody I think you should follow. And she was just banging the drum on estrogen. She's had breast cancer herself. She's now in her 70s. She is a big advocate for hormones for women post breast cancer. But she was telling me, and again, I'm not the doctor or the researcher. I have to go into the research, that there are different types of estrogen, because there's the estrogen that makes things grow, right? And we always talk about estrogen being a growth hormone, which is why it's great for bones, it's great for muscle, it's great for the things we want to grow. But we don't want to grow the endometrial lining and increase our risk for endometrial cancer. We don't want breast tissue to grow, and
mhm,
especially if you have a tumor there. But she also said that there's estrogen that is does the opposite effect, that tames things, that balances things out. I didn't know this, and she's talking about the different types of estrogen, or the estrogen receptors as well. So this is a whole can of worms that you can go and dive into if you want to. She talked about the 10 million women study. 10 million women. It's a lot of women in this study. She's got all these resources on her website that you can look into. And she was showing that the women who do take hormone therapy, and I think she did say it was all kinds. Because I was like, is it bioidentical? Is it synthetic? Like, what are we talking about? She's like, all kinds. And they showed that there was a less chance of a tumor recurrence if you were on the hormones. So this is just, she kept citing these studies again, like this is your
okay,
job to go and look into the
absolutely.
study, into the research, and to present. I'm not telling you to do this or not do this, but I was learning so much from Dr. Lindsay Berkson. But uh, if you are thinking, okay, hormones are definitely not for me, I don't want to even go there, my doctor said no, then Dr. Nasha Winters is another person to take a deep dive into, because she's a little bit on the opposite, a little bit, she's a lot on the opposite, she's totally on the opposite side of the spectrum. And she talks a lot about clearing the terrain, making the body as healthy as possible, and you can get through menopause without hormones. And she's got all these tricks and tips and things up her sleeve, and supplements and red light therapy and all these things that she's dived into. But she's just another person. Again, these two people totally in the opposite side of the spectrum, but I like to give people a
Yeah,
choice, whatever
absolutely.
resonates
Yeah,
with
yeah,
them.
absolutely. And I think it's a great idea because even though you have, if you didn't have any other conditions, then it's easy to make that decision versus when you have as well, you read about it and you have physicians telling you no, hormones are not for you because you breast cancer, but then you have other options, right? Which I think is a good thing for having both of them because you mentioned before, right? It's not just the hormone replacement, it is what do you do in your body. So it's just a piece of the puzzle. But you still needed to detox. You still needed to do and prepare your terrain. You need to still,
Mhm.
feed in your mitochondria. You need to really do all these other things to try to really help yourself. It's not
Yeah,
just,
and they both of these
yeah,
doctors would agree that with that
yeah, yeah,
100%.
yeah, absolutely,
Absolutely. So,
absolutely.
yeah.
Um, how do you factor like genetics, lifestyles, and culture influence the way that women experience menopause?
Oh, yeah. This comes from there's lots of research out there in terms well, not tons, but there's enough research showing the different cultural differences of women going through menopause. And I have interviewed over 200 women on the street just as a nomad. I'm traveling to a lot of countries and I stop women on the street, ask them 5 questions about menopause. So I can see some of this. It's not official research, but it kind of backs up what I'm reading. And there are women all over the world. We all go through menopause. Like no one's getting away with it. Okay. Like no
I
one's
wish.
like having her period in her 80s that it's a natural period without hormones. Okay. So we all will go through menopause. It's the attitudes that are different that I see towards it. And there are women who may in certain countries and also different socioeconomic levels. So if you speak to a woman in the US or in Canada or in France, like we're quite vocal about menopause. We're okay talking about it and we have our opinions, whether you like it, you don't like it, good or bad, that's another story. But they're open to the conversation. But sometimes when I meet women who's selling fruit on the street in Vietnam and she's got a whole other lifestyle, she'll look at me like, why are you even asking me about this? Like, I have much bigger fish to fry. Like, I don't care. I gotta feed my kids or my grandkids, and it's not a preoccupation on their mind. I also see this with women who have gone through a lifetime of diseases and pain and issues that by the time they get to menopause, they're like, oh my God, this is nothing compared to what I did before. Okay. So different people have different attitudes, and it's not only cultural, it could be socioeconomic, and it just could be what have they experienced through the life course. But we do know through research that women who have a supportive community or they have a partner who is there to support them, or if they wear the pants in the family, the woman is kind of like the one who did make these decisions. She tends to have a smoother transition, a better outcome. And again, whether she gets more diseases or not is not. I don't have the research on that. I don't know if it exists, but the attitude in terms of how you go through this transition matters because being negative, we know just negative in life, negative with any situation
Yeah.
is just going to make it worse. And
Mhm.
it's the same with menopause. And I'm not saying, oh, just have a good attitude when you're sweating and you can't sleep and your joints hurt and you're mad. And like, I know it's hard. They have a good attitude, right? So, but we can do things to alleviate the pain. And then it's much easier to have a better attitude about it. And at least and knowing that these things exist. And it's not like you just let's take hormones and everything's gonna be great, and because this is the stuff we hear, but there are plenty of women who have the side effects and it takes a long time for them to figure out the formula and it's not working right away and they get frustrated and it happens. It takes time, just like with any disease that we have or trying to combat. It's not like you take a pill and boom, it's all gone. It's very often if you have something going on, it takes a while for you to try different things and weed things out before you actually start to feel better. And I mean, and again, there are magic drugs and there's hormones can be magical, but it's just depends on how you react to whatever it is the treatment. So I just want to set that stage. Just like the expectation sometimes is like, oh, we'll just do this and it's all going to be good again. Especially if somebody's trying to sell you something, if it's a supplement or if it's somebody's a doctor even just saying, all my patients they all do fabulous on hormones and like, well, not every, it's, if anybody says 100% of the people get
Yeah.
100% of the outcome, I always have a little red flag. Like, I don't know. I mean, if you said 95, I'd believe you. But once you say 100, I'm like, no,
Yeah.
it get a little
Yeah.
skeptical. So we have to just be aware of some of these things and know. And that's why I like the biohacking spaces, because we just experiment with ourselves and we try things knowing that maybe it will work, maybe it won't. And if it doesn't, that's okay. We have a million and one other tools in our toolkit that we can use to try to feel better.
So, how women and midlife support their health? So, like for all the people out there listening to this, like they're going through this, they're listening to this part, and they're already experiencing some of the symptoms, and they start to realize, oh, wow, I think that's what I'm having issues with. How can they support their health? And as well with that, is reducing some of the risks of cancer, not necessarily breast cancer, but cancer as well.
Yeah. It's funny when we talk about cancer and hormones, the first very often, including me, my mother died of breast cancer. So if
Oh.
anybody's concerned about hormones and cancer, it's me. And just like everybody else, oh no, estrogen causes cancer. I heard about that big whole study and, and probably no. And now we know estrogen does not cause cancer. And I understand that. But if anyone's concerned about breast cancer and their health, well then definitely hormones is not the thing to worry about. It's about the real risks of that increases the risk, which is alcohol, which is obesity. These are things that are real big risk factors for cancer. And the hormones, my goodness, it's like a drop in the bucket, if anything. I mean, there's studies showing that it's protective against breast cancer, studies that show that no, maybe it is does increase the risk a little bit, but it's not even a discussion when you're still smoking, drinking, and eating the wrong foods and are overweight and obese. Like, put your priorities somewhere else. Okay. Don't worry about the hormones right now. Fix your health. That's what's most important at this time. And then the hormones, my gosh, it's like a secondary piece even to think about. So I think women who are feeling these symptoms, it's great. Actually, I'm very happy that you feel symptoms because at least you have a clue that something's shifting, something's changing, and then it's now the opportunity to change your diet and lifestyle. And then maybe have that conversation about hormones with your doctor, because we know there's one thing that most hormone specialists and menopause specialists do agree on, because they all disagree on a lot of things, but they do agree that starting hormones before menopause is actually much more protective for your heart, for your brain, for your breasts, for a lot of things. So bones in particular as well. So it's a good thing to explore that world if you are in this before perimenopause state. If you're postmenopause, it's not a closed door. You just need to approach it differently. But that's another whole other discussion. But if you are feeling these things, great. You know what you can do, and then you can change things. Some women, I would definitely start with the diet and the lifestyle, because if you are going to do the hormones anyways, like it's great to get the terrain all set up and you're detoxing well and the gut is all sorted out, and now you can deal with these hormones that you're putting in as well. They're going to be a better received. So, and I always like women to do this hand in hand. And sometimes it's hard. If you are suddenly feeling every symptom under the world and you cannot sleep and you're feeling horrible, me asking you to go to the gym and start cleaning up your diet, like that's a hard thing. That's really, really hard. So sometimes just getting on those hormones right away and cleaning up the diet and lifestyle at the same time is a really good protocol as well, because you're more likely to go to the
Yeah.
gym if you're getting
Yeah.
good sleep,
Yeah.
right? So I think that's, again, it's very personalized. It's how you do approach it is you are into control. You can do what you want to do. So again, I think we all know those pillars of longevity, the pillars of health, and that's getting your nutrition dialed in, whatever that may be. Like, I have seen people thrive on all kinds of diets now. Like, you got to figure that one out. And then the second one is movement. Again, moving any way you can, because I can't tell you to go do a marathon if you barely can get off the couch, but starting to move, and then the sleep and the stress component, managing your stress, whether it's physical pain or mental pain, emotional pain, we need to sort that out. And then also your community, your purpose in life, and who you are, knowing who you are. All these, this is sort of this other woo-woo side, but it is not woo-woo. There's a lot of
Okay.
research
Yeah,
showing how
yeah,
beneficial it is
absolutely.
to have this piece in place, and sometimes
Yeah,
it's just so much more powerful than anything else. So, or
yeah.
and they all interact with each other anyway. So those are those pillars, that foundation that I love women to get started with, and then you can go play around with the other parts, with the ice bathing and sauna use and red light therapy and PRP and injections and hormones and all these other things are um other things to add on once you've got that foundation real good.
So that lead me into another question, like what do you think like woman around 30s needs to know about menopause?
Oh, I'm so glad. If there's a woman listening who's in her 30s, such a good thing that you're listening to this, first of all, and you're being proactive and you're learning, because it's on average around 35 is when we start to lose progesterone. And this is what was taught to me at the Institute of Bioidentical Medicine. It was the first time I had heard of that. And it was Dr. David Rosensweet who created the menopause method. He's been treating women through menopause for 4 decades. So this guy knows what he's been doing. And it's been then repeated, of course, then you can go look at the research and find it. But I was shocked when I first heard that, because at 35, and losing your progesterone, and evidently it's quite fast, and it's not like estrogen where it takes a while to go down, like goes up, goes down. As progesterone can take a deep dive, and this progesterone is the calming hormone. This is a hormone that supports us during pregnancy. Like, it goes very, very high. It's pro and gestation. So, but we do have this in our cycle. It's a normal part of our cycle, and it's the hormone that usually makes us feel more relaxed, more calm, and more at ease. And when you're losing your progesterone, you feel the opposite. You feel more anxiety and you feel more stressed. You can't sleep very well. And this is a clue. If this is happening to you in your 30s, then you go, maybe I should go check out my progesterone. Maybe I should, you can test, you can see. And some doctors would argue, oh, that's not going to tell you anything. It's just a snapshot in time. And yes, blood work is a snapshot in time, but, or even through urine, but you can do them several times and see if you're trending. It's the trends that really matter. And if you are really low in your progesterone, and a good functional medicine doctor will know when to test you, because when is the most likely time that you're going to have a high progesterone, and you're low in progesterone. Like, you can supplement with a little progesterone cream. It's quite harmless in many, many ways. And this is the kind of thing, of course, still go talk to your doctor about these things, but it is a simple solution rather than taking sleep medication, anxiety pills. There's doctors give you medication because you're feeling bad, and that's what they know. Most doctors are not trained in hormones, so they wouldn't even think about menopause when
Mhm.
35-year-old, and they wouldn't think about progesterone.
Yeah.
Forget it, and they wouldn't test you. So this is why you're listening now and advocating for yourself, and you can get tested online. Like, you don't need a doctor's prescription anymore. I mean, unless you need that from your, if you have health insurance, then okay, that can pay for it. But usually this test is quite simple and easy and not very expensive, and you can get an at-home kit. And there's also some like at-home urine testing kits that I'm exploring to try to understand. One is called the Mira, Mira, and they say that this is a perfect time, perimenopause, to you pee on a strip and then you put in the little device and it tells you where's your progesterone, and you can measure every single day for months and months and see where your progesterone is. You don't need to go and get a blood test every month or every couple of weeks. So I think it's a really cool, it's promising. I don't want to advocate because I don't really know, but it go read up on it. It sounds like a great device, and it's something I would certainly do if I were in perimenopause, if I want to understand my hormonal fluctuations and on a day-to-day basis.
Okay. And how about for the women who are going through menopause? What are like the silent killers, and why should an asymptomatic woman should be more vigilant?
It's such a good question. So the silent killers that we know are, we talk, at least we talk a lot about, are osteoporosis and cardiovascular disease. Are some of them. Cognitive decline, memory loss, Alzheimer's
Mhm.
is as well, because these are things that can kill you. And you may go, well, osteoporosis can kill you? Yes, and it can, because usually what happens when you're at an older age and you're frail, and a frail person can be overweight. Okay, I always had this image in my head that frail people are thin and they have no muscle mass, and they're falling apart. No, if you have osteoporosis and you have a fall and a fracture, if you are frail, because some a lot this statistic gets thrown out a lot, you have a 30%, up to a 30% chance of dying within a year. And
Yeah.
that's a big
Huge.
statistic.
Yeah.
So how is that? Well, people are, they can get infections in the hospital. You can 50% of the people who have the fracture and fall don't recover. So if you are stuck at home, you can't see your friends, you have no community, you feel pain, you can't live your life, you're not moving anymore, you can't sleep anymore, you're depressed, you have all these stress hormones running throughout your body, you can die. You can just fall down that rabbit hole and get sick. You'll eventually get sick with something. And that's a serious thing. So that's how osteoporosis can kill you. Like it just sounds, or you do fall and you
Yeah.
bump your head and you die. I mean, that can happen too. And I don't know the statistics with it, but the statistic is really big. But I interviewed a bone specialist, and he was telling me this statistic is really, it's frightening, but it is mostly for people who are frail. Now, if you are in your 50s or 60s and you have osteopenia and you're scared shitless and oh my God, and I'm gonna be careful now, it's probably the wrong thing. If you have good muscle mass, even though you have osteopenia on a DEXA, and we know DEXA now has a lot of problems, I guess. It's not fully accurate, and it's only a part of the picture. It's not just, it's kind of like when you go, oh, I have high cholesterol. Is that bad? Oh, should you be on statins because your total is too high? No. What about the women who are, or men who are having a very healthy lifestyle, and they go deeper into oxidized LDL. They look not just HDL and LDL, they look at their MPO, they look at their LP little a. There's a lot of other cardiovascular markers and testing that you can do to see, are you likely to have a heart attack? Because
Mhm.
it's the heart attack that we care about, not a number. I
Yeah.
don't care if your osteopenia T score is whatever. It what I care is that, am I going to have a fracture if I fall? Am I going to die if I fall? Like
Yeah.
that's what I care about. And that's why these numbers or these tests can be deceiving, and we don't want to put all of our weight into just a number. And I
Yeah.
think this is some of the things that we do need to, pay attention. This is, we got to
Yeah.
watch as we go along, and then dive a little deeper before you take that statin or before you take that osteoporosis medication.
Yeah.
Maybe you need it. I don't know. But it seems to be a reflex for a lot of doctors just because of a number. And I think
Mhm.
if you are concerned about your health and you do want to take a deeper dive and you have time and you can agree with your doctor to do that, take a little deeper dive and learn a bit more, because maybe you can make some lifestyle and diet changes and avoid taking medication, because with a medication, there's always side effects as
Yeah.
well.
Absolutely. Yep. That's true. Um, what are your top biohacks for managing common menopause symptoms?
Ooh, depends. Yeah, the common ones. Let's say, oh my gosh, one, hot flashes. Okay, so hot flashes is a very common one. It's the one we think about, but there are plenty of women who do not have hot flashes. They have all the other symptoms, but they don't have the hot flashes. But for the hot flashes, across the board, the research shows the most effective is hormone therapy. It'll stop it in a flash. No pun intended. It'll stop it really, really quick. You don't need a lot of estrogen to stop a hot flash. There are supplements. So if you're like, no, that's, I'm not doing hormones, that's not me, or I'm not there yet, whatever. There are plenty of supplements that you can experiment out with there. So you can say, you can, the research shows when it comes to supplements, the research is mixed. You'll find research that supports ashwagandha for your mood and research that shows it doesn't work. So it's kind of a hit and miss. I've met plenty of women who it does work for and women who doesn't. So it's kind of, you get a test again with your doctor's guidance, because if you have a certain issue, because just because it's a supplement you could buy it online doesn't mean it's safe. Like I don't know what you're taking or medication you're taking or what. So always do your homework before popping a pill. But pycnogenol is an interesting one for hot flashes. It's also called French pine bark, and that seems to work pretty well. There's also, when we talk about I'd like to talk not just about hot flashes, but I mean, if you are actually, another thing other than supplements for the hot flash or night sweats, which I'm putting in the same category, there's our vasomotor symptoms. So ice bathing is one. And you may go, well, actually, it sounds pretty good when you're having a hot flash. It's pretty easy, but there's some research showing that there's a 50% decrease in hot flashes with that. So you can experiment with that, or take a cold shower, and that may help as well. And maybe even training your body, going, okay, I know this is a good thing for me. And the sauna is funny because there are women who say it helps with their hot flashes, but to me, I think, oh my gosh, you're going to trigger a hot flash, right? You're in a hot situation. But I've seen both. Like, so it's you have to play around with that. But we do know certain foods can trigger a hot flash. Alcohol is one. A spicy food, or just hot foods, a hot coffee or hot soup, these kind of things. If you see, you should take a piece of paper, or there's always plenty of, you can find online a symptom chart, and you start tracking things day by day. And this is the biohacker in you, because you're going to figure this out on your own. If you don't test, measure, and assess, if you don't write these things down, it's going to be hard to make these associations. Or harder at least. So writing these things down is really cool. Black cohosh is another supplement that was the one I was looking for. A lot of women like that one as well. And exercise. Exercise is always a good thing. So get exercising, even though you may go, oh, well, that's going to make me hot, but that helps regulate vasomotor symptoms.
That's
With the what?
No, go ahead. Go ahead.
So sleep, when women, it's a very common complaint. It seems like everybody I know can improve their sleep, even if it's pretty good. You go, well, it's pretty good, but when you sleep like a 20-year-old again, you're like, oh my God, I didn't realize how bad my sleep was.
Mhm.
So don't, and women, we tend to like white knuckle our way out of this stuff, right? So one very effective way is progesterone, a progesterone cream or oral. It's usually the oral that has a better effect for that I'm seeing in my community. But if progesterone, you'll have to get a doctor's prescription if you want oral progesterone. And but if you don't want to go to the progesterone route, the cold shower again is another great thing for sleep, or sometimes contrast hot and cold. And I'm a big fan of breath work. I've certified with the Oxygen Advantage. I've taught it, I've tried it. It's incredible. Is just go on YouTube and say breath work for sleep, and you're going to find 1,000,000,001 videos to guide you to sleep. It's so powerful. Um, and then there's the red light infrared saunas are really good as well. A lot of people get good sleep with that. And there are a couple of supplements like magnesium, also super effective for a lot of women. Again, not everybody across the board is feeling it, but that helps relax the muscles as well. So make sure you have a high enough dosage as well. And spermidine is another cool one, and glycine is another great one for sleep. Some things that people haven't heard, but I could go on forever and ever, but I think we're gonna have to wrap up. But
Yes,
those are
yes,
two of the most common.
absolutely. Yes, that was a very good thing. And just one last thing to wrap up. If you can give an advice to women who feel anxious and prepared or overwhelmed about this phase of life of menopause, what that will be. Listen to your podcast.
Educate yourself.
Yeah.
Just learn more about it. And try to fill your feed, if you are on social media, with positive menopause information, because it can be frightening. And there are women out there who, maybe a lot of them are not even talking about menopause, but I'm in my 60s and I'm doing this, jumping off a cliff, or I don't know, like living my life or traveling the world, And you can get inspired by these people who are going through menopause or in menopause or post-menopause, and you'll see there is a life after menopause after you figure this all out. But educating yourself is very, very key so that you know what you can do to alleviate these symptoms and protect your future self.
Excellent. Well, it has been a lot of great information, and I could have you for another hour. So thank you again for being part of the show. I really appreciate it.
Oh, thank you so much, Durley.
You take care. Have a great rest of the afternoon in Portugal.
Yes, yes, I
Okay.
will. Thanks so much.
Okay. Bye.
Bye.